Last week, the Democratic Republic of Congo (DRC) launched an immunization campaign largely to slow the spread of the latest outbreak of the deadly Ebola virus. In the past, news of an Ebola outbreak in DRC would be met with a wait-and-see approach by our authorities here as panic set off in the general public. And usually, without strong interventions, the viral disease quickly leaps across our western border with the Congo and outruns the slow response from Ugandan authorities, leaving many dead. Gladly, Kampala has eventually developed a viable quick-response mechanism to hemorrhagic fevers, including the equally nasty Marburg and the Crimean Congo hemorrhagic fever, CCHF, which has already killed one person in Mubende district. Health officials have responded well enough to the current threats, including isolating and carefully monitoring all the attendants of the deceased, who included his expectant wife and 4 others. On May 10, 2 days after DRC announced an Ebola outbreak in its western border town of Bikoro, about 1,945 kilometers from the Ugandan border at Mpondwe, Kasese, Uganda's Ministry of Health announced its own preventive measures. These included the screening of travelers at Entebbe International Airport and other vulnerable border entry points. Anyone arriving from the Congo, the ministry said, would be screened. The health desk for Ebola signs and symptoms. A private medical center at the airport has also been equipped to provide counseling on clinical screening of all suspects. A standby ambulance with a driver and relevant protection gear has been provided by the Civil Aviation Authority. The ministry also instructed leaders in Kampala, Wakiso, Kanungu, Kasoro, Kasese, Bundibugyo, Hoima, Baliza, Nebi, Eruat, Maracha, Koboko, Kibale and Kibale to reactivate their district task forces in preparation for any possible outbreak. There is also a toll-free phone number 0800-100-066 for anyone to call to report any suspected cases. This sort of response is very laudable and demonstrates that we have learned hard lessons from past stumbles in government's handling of disease outbreaks, more so the 2014-16 Ebola epidemic, which exacted a heavy toll in West Africa, killing hundreds of healthcare workers. A proactive approach, if embraced, will help this country survive the grave realities of our times, including sophisticated crime, debilitating diseases and corruption.